So welcome to this session. We are really pleased today to discuss the role of parliamentarians in moving the global health agenda forward. We are pleased to welcome parliamentarians from around the world in this session and in this summit this year. This is an added value and we look forward to a fruitful discussion. The session is divided into 3 parts. A high-level segment with a ceremony to announce a new collaboration to mobilize parliamentarians around global health, a panel discussion and a moderated discussion. In the first part of the session, the World Health Organization and UNITE, Parliamentarians Network for Global Health, will sign a new memorandum of understanding. We believe that the World Health Summit is the perfect occasion to inaugurate the beginning of this new collaboration and welcome a stronger engagement of parliamentarians also in the future editions of the summit. Now the floor to Dr. Tedros, the Director General of WHO, followed by Honorable Ricardo Batiste Leite, UNITE President and Founder. Dr. Tedros, please.
I think you must be tired of me now. Yeah. Your Excellencies, dear colleagues and friends, I thank our hosts, Germany, for bringing us together today. We're honored to be joined by 40 parliamentarians from more than 30 countries. I'm also pleased to welcome representatives of key parliamentary platforms, including the Interparliamentary Union, the Parliamentary Assembly of the Council of Europe, the European Parliamentary Forum for Sexual and Reproductive Rights, the UHC 2030 Parliamentary Network, UNITE, and representatives of regional parliamentary networks. I especially thank the Bundestag Subcommittee on Global Health for hosting discussions among parliamentarians this week, yesterday, about sustainable financing, peace for health, and reproductive health. As a former parliamentarian myself, I know the critical role parliaments play in driving progress in global health by passing legislation, keeping governments accountable, allocating adequate funding for health, and by representing the needs of the communities they represent. Parliaments will also play a key role in strengthening the global health architecture in the areas of sustainable financing and developing and implementing the International Accord for Pandemic Preparedness, Prevention, and Response. Over the last few years, WHO has intensified its engagement with parliaments on our key priorities of universal health coverage, global health security, and health promotion, especially for vulnerable groups, including women, children, and adolescents. A significant milestone was the adoption by the Interparliamentary Union Assembly of a resolution on universal health coverage in 2019. This is only the first of many milestones we would like to achieve with your support. WHO is now rolling out our first strategy for parliamentary engagement, which includes a series of key initiatives. I'm pleased today to announce the creation of a new global network of chairs of health committees to establish a systematic dialogue with national parliamentary bodies in charge of health and to mobilize political support around key global health priorities. Today, we're joined by chairs of health committees from all 6 WHO regions who have met here to work with us on the terms of reference, composition, and concrete activities for this new network, and I look forward to a fruitful collaboration. I'm also happy to introduce One of our key partners, the Unite Parliamentarians Network for Global Health, as a new member of the WHO Partners family. Unite will support WHO's engagement with parliaments with a focus on three major areas: equitable access to health, with a focus on adequate budget allocation for universal health coverage; sustainable financing for health system strengthening, including for the work of WHO, following the decision of the World Health Assembly this year; and strengthening the global health security architecture, especially the international accord and its implementation in countries. Today, I'm honored to be joined by my friend, Dr. Ricardo Baptista Lete, member of the Portuguese National Parliament and the president and founder of Unite, to sign this commitment. Ricardo, thank you for your partnership, and I look forward to working with you closely to harness the power of parliaments with health. Over to you.
Dear Dr. Tedros Ghebreyesus, dear Gaudens Silberschmidt, dear Unite members and other members of Parliament here present today, dear colleagues. Nearly 20 years ago, I started working as a young medical doctor in an infectious diseases ward in Portugal, and what I experienced there truly changed my life. I met patients who couldn't make it to the hospital because they couldn't afford public transportation to get there. I diagnosed patients infected with multi-resistant tuberculosis and keeping them in isolations, praying that the treatment would work that time. I particularly remember a man in his 20s who was in the hospital, and his mother would visit him every day, but she would not go inside the room because she was ashamed that her son was living with HIV. He died without feeling a last hug and a last kiss from his loving mother. And all because of lack of education, stigma, discrimination. Inequities and poverty have led to poor health and deaths across the world. And I share these stories with you today because I know I share this with many members of parliament here, when I was elected for the first time into parliament, I felt that responsibility to be part of the fight for more equitable society at home and abroad. And that is why 6 years ago, exactly here at the World Health Summit in Berlin, I pitched an idea of creating a network of policymakers that would then become leaders for global health. And thanks to the support of partners, that dream has become a reality, and the now known Unite Parliamentarians Network for Global Health is present in more than 85 countries and has more than 240 members from parliaments, congresses, and senates from around the world. And our mission is straightforward. We aim to transform scientifically sound recommendations into concrete laws. We ensure that money gets where it is needed through budgets, and we hold governments accountable. With this memorandum of understanding that we are signing here today, we are taking a step forward in that direction by establishing a formal partnership between the parliamentarians of the Unite Network and the WHO. We will work together towards achieving a new pandemic treaty or convention to be ratified by parliaments to ensure that all will be done to contain outbreaks and prevent future pandemics. We will actively transform current disease response systems into health ecosystems capable of promoting well-being for all and not just for the few. Together, we will foster innovation and digital health as a means towards achieving universal health coverage and the SDGs by 2030. And by joining efforts with civil society and patient advocates, we will put citizens front and center. As we have seen in the COVID pandemic, health threats do not recognize borders. And if we do not work together, we will indeed fail the people we have been elected to serve. Unite and WHO have come together to ensure that failure is not an option. A special thanks to Elisa Scolaro and to Dr. Gaudens, without whom this partnership would not be possible. I also present a heartfelt word of gratitude to the Unite Secretariat for their dedication and hard work. Without you, this would be impossible, so thank you. And a word also to all of the Unite members here today. You have made this commitment not only to serve as policymakers in your own country, but to give up part of your lives to improve the global health for all. And for that, we are all truly grateful. And to end, I would like to thank you, Dr. Tedros, for the trust that you have put into Unite with this agreement. I promise you that the hundreds of parliamentarians in our network across the world will not let you down, and together we will achieve health for all. I normally end my speeches saying that it's time to unite, but today I want to ask for all of your help. When I say it's time to, I want everyone to say unite. So here we go. It's time to? Unite. You bet it is. Thank you very much. Thank you.
But please stay there. I now invite Ricardo Batista Laita first to sign the MOU, then followed by Dr. Tedros. And the second copy.
Today is what?
18.
Okay.
Thank you very much. And I invite to the floor the Honorable Akwa Sena-Dansua, who will be moderating the second panel. She's a former member of Parliament of Ghana and former ambassador of Ghana to Germany, and a long other list of achievement, which I, for the sake of time, don't bring. I invite you to look in the program. Aqua, the floor is yours.
Thank you very much, Gaudence, and good afternoon, Excellencies, colleagues, and friends. I have the honor to moderate this third section of the session, and I invite all our panelists to take their seats immediately. Knowing that we've lost a lot of time already, I will indulge you to stick to the 4 minutes that each of you have been allocated to do your presentation, so that we can have enough time for interaction between us and the audience. Having said that, I have the honor to introduce the first speaker, who is Mr. Eshanis, Member of Parliament of Spain, President of the Defense Committee of the Congress of Deputies, and who is joining us also in his capacity as the chair of the Interparliamentary Union Advisory Group on Health. He is joining us directly from Kigali, where IPU held its assembly. Dr. Eshanis has a degree in medicine and surgery with specialization in health economy. At the national parliament level, he is currently, as I said before, President of the Defense Committee, member of the Foreign Affairs Committee, and of the Health and Consumer Affairs Committee. He has been a member of parliament since 1996. With these remarks, I cordially invite Mr. Eshanis to present his paper. You have 4 minutes only. Thank you.
Thank you very much, dear Aqua. Thank you, dear Godens, for your presentation. Dear Ricardo, congratulations for this memorandum of understanding. Dear members of the panel discussion, dear colleagues, MPs, ladies and gentlemen. IPU is a global parliamentary organization. It's the organization of national parliaments founded in 1889, who represents all the parliaments around the world. Our headquarters is in Geneva. We have offices, regional offices and offices in New York and Vienna. And IPU works in a very close relationship with United Nations and its SDGs. IPU has 178 members, parliaments, representing 46,000 members of parliament, and also more than 70 permanent observers and closely all the citizens of the planet. One of them is UNITE. Since the last week, we are very proud to work in the future with UNITE also. I am Vice President of IPU and Chairman of the Health Committee, that is called Advisory Group on Health. And IPU is longest standing partner of the WHO, and we want to thank that this summit is recognizing the important role of parliamentarians. This committee, Advisory Group on Health, is made up of parliamentarians who are experts in health matters, health economics, public health, health management, epidemiology, etc., covering a broad spectrum of knowledge and experience. We also work with a large number of partners in the healthcare field, not only WHO. Dr. Tedros has participated in several of our assemblies, but also Partnership for Maternal, Newborn and Child Health, for example, United Nations AIDS, Global Fund to Fight AIDS, Tuberculosis and Malaria, Gavi, the Vaccines Alliance, and many others. Over the years, we have worked on many of the most relevant issues in the health field. One of our most important endeavors is the universal health coverage, also its implementation by parliaments, its stable funding, its prioritization in the general political agenda, its monitoring and accountability. For all this, you need legislation oversight, accountability, budgeting, advocacy, policies, programs, control of compliance, and investment. And all this is done by parliaments on behalf of citizens, giving voice to the needs of the people, as especially to the most needy and vulnerable. IPU works for a world more peaceful, more democratic and equal, and health is central, totally central in this vision, in particular in relation to equity and human rights. At the global level, the International Parliamentary Union mobilizes political will and provides a platform for the changes of parliamentary practices and lessons learned. The Advisory Group on Health of IPU provides guidance to the global parliamentary community on effective strategies to improve health and well-being. And dear friends, parliaments can be effective and powerful agents of change. This is why it has an institutional approach to empowering parliament by providing assistance at the national level, developing tools and knowledge products tailored at parliamentarians. For example, the last March, a handbook on global health security was published with WHO, and a new handbook on universal health coverage will be published at the end of this year, jointly also with WHO. If there is time later, I would like to tell you about some of the concrete results of our work. Our partnership has been crucial in bringing the parliamentary and the scientific communities closer together and positioning parliaments as key actors in the health and the global and the national levels. Now we are discussing internally what's the role of parliaments should be in the approval of the treaty or convention on pandemics beyond its certification by the parliaments on each country, or in the possibility of improving the stability of WHO financing and any related matters with global health, as for example, air pollution as one of the great challenges to health. We provide could produce more than 7 million premature deaths a year. Well, dear friend, I finished my 4 minutes and I will make additional comments if there is time later. Thank you very much to all of you. Thank you very much.
Thank you very much, Mr. Shanis, for taking us through the global level and what the IPU works on and how we can leverage on the experiences of the IPU on the universal health coverage. Thank you very much. I now take the opportunity to introduce the second speaker, who is in the person of Professor Dr. Andrew Ullmann, Member of Parliament of Germany and Chair of the Bundestag Subcommittee on Global Health. If you allow me, Dr. Ullmann, can we skip your bio and go straight to the presentation, since we want to save some time? Is it okay by you?
That's absolutely okay by me. And if anybody's interested in my bio, you can look Wikipedia.
Thank you.
It makes it easier. First of all, I would like to congratulate UNITE for its leadership. The Memorandum of Cooperation with the WHO is a new milestone. And as UNITE chair for Western and Central Europe, I'm very proud and looking forward to the new cooperation. And my many heartily thanks to Ricardo for making this possible, as we met 5 years ago with some similar histories when you were talking about infectious diseases. I could have brought up some stories of my attending. A lot of people know him, Paul Farmer, who passed away too early this year. He was the one who actually planted the idea of global health into my brain when it was back then in the 90s, only about Haitian Republic and more issues going on. So we have a similar past, and thank you so much for your leadership, Ricardo. As you have already heard, we as parliamentarians play a crucial role in pushing the global health agenda forward. Parliamentarians are vital partners and advocates for health. We as parliamentarians are essential to achieving global health goals because of our ability to enact legislation, harmonize existing laws, create an enabling legislative environment, and legitimate legal barriers to existing healthcare. We are responsible for budget allocation and keep our governments accountable. From my experience as chair of the subcommittee, I can assure you that German parliamentarians, independent if they are in the governmental coalition or in the opposition, are committed to global health. Germany is the first country to have created a formal subcommittee on global health within the parliament. It is now the second legislation period with a subcommittee on global health. Since this legislative period, it is extended by its size of members and is embedded within two committees, namely the Committee on Health and the Committee on Economic Cooperation and Development. This gives us the chance to discuss the topic on a more interdisciplinary way. Our mission is that global health remains high on the political agenda. My personal, actually our parliamentarian wish is that we will establish a full committee on global health in the near future. The idea behind the subcommittee was born out of the fact that health challenges go beyond national borders. Health and well-being need to be understood on a global level. The effects of infectious diseases such as Ebola or tuberculosis, as well as antibiotic-resistant climate change, go far beyond national borders. In order to take this development into account and to facilitate bridging cooperation and exchange between all parliamentary bodies involved, the Global Health Committee was established. The subcommittee gives global health policy more visibility and relevance among the members of the Deutsche Bundestag. As much as some of you noticed, we had a parliamentary session in the German Bundestag on the Virchow Prize for Global Health just before the World Health Summit last week. We, as members of the subcommittee, pushed our parliamentarian groups to have the session in the Bundestag to send a clear sign of support on global health. Currently, we work in a coordination matter to raise the budget for global health programs. And as you know, in times of complex crises, when headlines shifted away from COVID-19 towards inflation, energy prices, and the war in Ukraine, it is a challenging task. We also work together as a subcommittee on recently passed, as a subcommittee to recently pass a resolution on global health in the German Bundestag. From my heart, I believe I speak for all members of the subcommittee. We share the interest to work with the WHO, and we're happy to support other countries to implement such a structure if needed. Thank you for your attention.
Thank you very much, Dr. Ullman, for sticking to the time and also for giving us an insight into the innovative strategy adopted by the Bundestag. I think it is an innovation that most of us in our parliaments can emulate, so we can give special attention to global health issues. Having said that, I wish to introduce the third speaker, who is Miss Andrea Alvarez Marin. Did I get it right?
Yeah.
Member of Parliament of Costa Rica, and also part of the Global Shapers San Jose, a World Economic Forum organization for young leaders. She will speak on how regional networks can support parliamentary work, facilitate the dialogue among national parliaments, and again, bridge the gap between policy and science. Ms. Marin, you have the floor for 4 minutes only.
Thank you very much. Hello, everyone, and I'm really honored to be a part of this panel today. I think that one of the major challenges of pushing ahead health legislation has to do with the gap between public health professionals and the rest of the public. If we focus on the kinds of conversations that we have been having in this summit, all of us usually speak about the social determinants of health and risk factors and the causes of the causes. But if we go to the general public still thinks of health as access to healthcare only. And this makes it hard to push legislation, and partly explains why recently in our Committee of Social Issues, cancer treatment bill passed swiftly through, although in my opinion, it will have a low impact, while more needed legislation such as labeling, taxes, and food marketing legislation tends to be archived. And it's because other Congress people don't see these measures as being effective for prevention. I think one way to bridge this gap is through regional networks. Since 2015, the Pan American Health Organization has been organizing yearly conferences in which the heads of the health committees and social committees come together and discuss best practices, common failures, and the most recent evidence, so that among parliamentarians, we can see what worked in other countries and apply it to our own. But I still think that a global network such as the one that was announced today has to be complemented with regional networks, because globally the conversations will be around the main challenges and the main solutions, but these solutions always need to be operationalized on the national level. And by having regional networks such as PAHO, we can, that with countries that have a common history and common challenges, it's useful for us to apply this legislation locally. Yet, I think that dialogues among parliamentarians are examples of top-down initiatives, and we must not forget bottom-up approaches to health. Because if we think about ministries of health, they are usually constrained and focusing on the diseases that have the highest prevalence. But as Congress people, we can talk and interact with people that suffer from what I like to call invisible vulnerability, which is vulnerability that hasn't even been recognized as such. So recently in our Congress, we proposed a bill that focuses on people that are suffering from rare diseases, which affect only 5 people of each 10,000 people. And what I liked about this effort is that the bill was written exclusively by people and families that have lived experiences. I simply presented the bill in Congress. And I think that was far easier for me to do than for a Ministry of Health because of the tyranny of prevalence that I like to talk about. And finally, as you mentioned about how to bridge the gap between science and policy, I think in all honesty, we will never be able to fully bridge that gap, but we need to be pragmatic about it. If we think about the ministries of health, they usually can and should be based only on technical considerations. But as you probably all know, as parliamentarians, we not only have the luxury of seeing the technical, but we also have to balance economic issues, political issues, social issues, cultural issues. And many of the bills are usually the result of making a lot of concessions. Another issue, I think, is that the time frame of scientists and the time frame of politicians are very different. Sometimes science takes a lot of time to do to achieve a research result. And as politicians, we need to act now. So sometimes we don't have the luxury to wait for a scientific paper to come out. And in this sense, any legislation will always be based on incomplete evidence. But I think we, and as parliamentarians, we need to think, who are also public health professionals, I think we also need to change the way we think about excellence in policymaking and not think so much about excellence as the best possible bill, but think of excellence as a bill that is approved, because a bill that is approved will start to make an effect in people's daily lives as soon as it goes out of Congress. So that's it for now. Thank you.
Thank you very much, Ms. Maren, for your enlightening presentation. As you can see from the program, we had earlier advertised Dr. Inaya Ezzedine to be the 4th speaker, but unfortunately she had to return home yesterday to attend to an emergency. But in her place, we have an able representative in the person of Dr. Bilal Abdallah, Head of Public Health, Labor and Social Affairs Parliamentary Committee. He will speak on his experiences in his region and also go on to present the paper that was initially expected to be presented by Dr. Ezzedine. So on this note, may I kindly invite you to do your presentation? 4 minutes only, sir.
Thank you very much. I apologize firstly in name of my colleague, Dr. Inaya. She had to leave urgently to Lebanon, and I will read her speech because she's following the things. I'm following the health, labor, and social security. Thank you for giving me the opportunity to be with you to discuss how we as a parliamentarians can move central the health agenda forward, central to security and development. The crisis led to severe health and socioeconomic impact, marked multidimensional insecurity, named food and health insecurity, with loss of social protection and disruption of essential health services and functions, women and girls being disproportionately affected since. Females healthcare workers are the majority. Secondly, household wives shouldered the burden of caring for children, elderly, and hospital household duties. Women were victims of increased violence and resulting stress, depression, anxiety, and suicidal attempts, as well as suffered from disruption of health services, example, reproductive health system services, further necessary needs and products. Our region is part of this world and went through same consequences, besides the fact that some EMRO countries are among the weakest and poorest in the world. The pandemic has grossly exposed the inequality and magnified them, especially in countries that have been suffering economically for some time before the pandemic, and countries that received influx of refugees across their borders. This further destabilized the health system at all levels. What is required for a healthier, safer, and more equitable forward for all is to make efforts towards a set of decisions on path to have been discussed with EMRO in the Regional Parliament Forum for the last 2 days that we expect, if adopted, will make a difference in the countries of our region. As chair of Women and Children Parliamentary Committee, women are not isolated group of society, and equality and empowerment should be integrated and ensured in every right-based and people-centered approach to health. This includes ensuring a gender-based approach to health services and policies, and increasing relevant investment in health. Challenges we face are many. I will mention a few of them that needs to be addressed by parliaments. Gaps, first, in evidence and systematic data collection across several areas. Gaps, evidence based in policies including mental health, food security, girls and women living with disabilities. Regional gaps in preparedness, which includes integrated health and security towards climate change, water scarcity, food insecurity, the digital divide, and the relationship between public and private sector in terms of these demands. Addressing to health disparities and inequalities should embrace the social and economic determinants of health and focus on whole of society as well approach as whole government. Empowering women is not a recipe of one size fits all. It should be contextualized to countries and communities in order to set the right priorities, and empowering women to become part of the decision-making in society and in politics. We need to empower women and to encourage their leadership skills on the executive, legislative, and community levels. And sure, we are looking forward for help to EMRO that is very active in our region. Thank you.
Thank you, Dr. Bilal Abdallah, for letting us into the experiences of your regional parliamentary forum with a focus on parliamentary actions to promote gender equality and women empowerment. Thank you very much. At this stage, may I humbly invite Dr. Shinburen Shiji Shuren.
Right. Yeah.
Correct?
Correct.
Thank you very much. He's our fifth speaker for the afternoon. Dr. Shinburen is an experienced surgeon with critical achievements in terms of advancements in diagnosis and treatment. He's also an active member of parliament, where among different initiatives, he has founded a working group under the Standing Committee on Innovation and E-Policy to completely digitalize healthcare. Dr. Shinburen will speak on the Asia Pacific Parliamentary Forum on Global Health with a focus on parliamentary actions to strengthen health security and build resilience for the future. You have 4 minutes, please.
Thank you. Good afternoon. It has been my pleasure to join this year's World Health Summit alongside such a diverse and inspiring group of leaders uniting around one aim. How can we combine forces to make the choice for health? I'm delighted to join this panel and share my experiences of parliamentary engagement for global health at the regional level. From my perspective as a member of State Great Hall of Mongolia and the Asia Pacific Parliamentarian Forum on Global Health. The COVID-19 pandemic demonstrated again that political leadership is a necessary and often decisive component of effective domestic and global action for health. We have been reminded of the importance and challenge of bridging the gap between evolving and increasingly complex science in the scenes in the evidence and the dynamic and constant space of politics and policy making. Parliamentarians can make a profound contribution individually and collectively through our core functions, including lawmaking, government oversight, authorizing budgets, and our mandates to engage in multi-sectoral and international partnership. The Asia-Pacific Parliamentarian Forum on Global Health is one mechanism that parliamentarians in the Asia-Pacific region have used to help bridge the gap and catalyze parliamentary action for health. Established in 2015 with the ongoing support of the World Health Organization, the forum is open to parliamentarians from 30 countries across Asia and the Pacific, and it's currently chaired by the Honorable Min Seok Kim of the Republic of Korea. The forum has met in person 6 times to discuss and share lessons on regional health priorities. It also met virtual on 4 occasions during the COVID-19 pandemic to build regional solidarity and parliamentary leadership for the response. In August of this year, the forum met in Seoul to build upon those conversations and discuss how parliamentarians could contribute to strengthening health security and health system resilience beyond the COVID-19 pandemic. I want to highlight 3 particular ways in which the forum supports parliamentary engagement for health in the region. First, the forum connects parliamentarians with international expertise and evidence from the World Health Organization and other institutions. Not only does this build knowledge and awareness, it allows parliamentarians to share what kind of evidence is needed and how it can be packaged to influence and support policy making. Second, the forum provides the space for parliamentarians to share experiences on translating evidence into parliamentary action in support of health priorities, including witnessing practical implementation in the host country. We are a diverse group, but we face many common challenges, and there is much we can learn from one another. Third, the forum enables us to catalyze political commitment and partnership to achieve regional health priorities. Attendees at the August meeting adopted the Seoul communique that urged fellow parliamentarians to take action in support of health security and system resilience. The COVID-19 pandemic continues to challenge us, but it also presents us with an opportunity to enhance and embed parliamentary engagement to elevate health in the political agenda. On behalf of the State Great Khural of Mongolia, we very much look forward to promoting these efforts in our region as the host of the 7th Asia-Pacific Parliamentarian Forum on Global Health in 2023 in primary health care. Thank you, and I look forward to the remainder of the panel discussion and the summit.
Thank you very much, Dr. Shimburen, for talking about the Asia-Pacific Parliamentary Forum and what you are doing to promote global health in your region. Having spoken on the roles of the various parliaments and parliamentary groups earlier, we'll now shift attention to the 6th and final speaker, who is Ms. Celine Sayek-Boyke. She will speak on the role of parliaments in strengthening health security. And in doing so, she will focus on the last 2 years' experience with the COVID-19 pandemic, but looking forward to the future. You have the floor, Ms. Boyke. Thank you. 4 minutes.
Thank you very much. First of all, I'd like to thank the organizers for this very fruitful roundtable and debate, and for having a democracy vivid together with the expertise out there. And I feel very honored to actually have experienced the Memorandum of Understanding being signed, but more so looking into the future where that Memorandum of Understanding is going to be actually implemented and where the expertise will meet with politics and create the political will to actually convert words into action. And I feel honored to represent the Parliamentary Assembly of the Council of Europe, of which I'm a member of, and I chair the Committee on Social Affairs, Health and Sustainable Development. As such, the pandemic has been a core issue we have been tackling, like all politicians and parliamentarians who are sharing this platform today. So I'd like to talk to you a bit about what we've done at the PACE and how we've collaborated with WHO and what we look forward to doing more in the future. I think first and foremost, we learned as parliamentarians that we had to be swift. We had to be swift and quick in responding to a very widespread pandemic that was affecting millions across the world. And already in March 2020, in the Parliamentary Assembly, at the Committee on Social Affairs and Health, we took rapid action to draft the first report on COVID-19 with collaboration with the WHO, where we were able to hear the evidence from the experts and carry that with a political will into action through a Parliamentary Assembly resolution and recommendation, which was titled Lessons for the Future from an Effective and Rights-Based Response to the COVID-19 Pandemic. This happened swiftly at the very outset of the pandemic. And since then, we've adopted many other reports taking into account the multifaceted nature of the crisis. We were swift in realizing through the expertise that indeed this was not a unilateral issue. It was intersectional. It was affecting children, elderly, migrants, women in different dimensions. And indeed, we had to take this into account in our policy responses as well. As such, we drafted reports on vaccines, on securing safe medical supply chains, on the impact on children, on migrants, on our democracies, and on the rule of law, and more so on overcoming socioeconomic inequalities, because we quickly realized with the expertise and the experience on the ground that indeed inequities that were already out there were only deepening the effects of the pandemic and the inequalities. And our rapporteurs actually drafted these reports, and I think this is the critical message, with close collaboration and cooperation with the experts of WHO. And you will see in our resolutions and recommendations that this is indeed politics that is driving evidence-based policymaking. And we thought this important because at PACE, we value to protect rule of law, human rights, and democracy. And we were quick to realize and know that at a time of rising populism, where our democracies were under attack, we had to protect our democracies by bringing evidence-based policymaking into the political arena. Because facts and correct information is what we need to convince the public to take steps collaboratively and with consensus and to protect our democracies. And therefore, I believe this experience was not just one of making sure our individual health was protected, but it was an experience of building a new politics that was driven by evidence-based policy and that would actually protect the health of the society and the health of our democracies. So we've actually carried on this collaboration in further reports. For example, one report was on COVID-19 vaccines, ethical, legal, and practical considerations, where we dealt with multiple issues that the health experts are dealing with. And we took it into a political will in making sure that we actually underlined among 46 member states' parliaments that we need quality trials and standards of safety, efficacy, and quality in the development and regulatory processes of vaccinations, where we underlined policy recommendations to member states concerning equitable access and deployment of vaccination, not only in our member states, but making sure that across countries we would have a similarly equitable allocation of vaccinations. We also underlined the need to uptake transparent communication, which was a message that was strongly given by the WHO and their expertise, and proper monitoring mechanisms. And this report indeed had immense public attention and media attention, which is proof of the need to have collaboration across those who have the expertise and those who should be building up the political will. And finally, we've underlined in many of our reports that universal health coverage and access to equitable health services is a right we have as people, not a luxury to be granted to us, but a right that should be granted and guaranteed and enshrined through our political and legislative coverage. And I have no doubt our collaborations will continue. For example, we are now preparing a new report for which I'm the rapporteur on public health emergencies in working on a holistic multilateral framework where collaborations are not limited to those with the WHO, but that include, for example, the World Trade Organization to ensure that we discuss the role of intellectual property rights, for example, or the role of global public goods such as health and vaccination and medication, and where we as policymakers could bring together the multilateral institutions to make sure that a rights-based future is established through our legislative roles. Therefore, for the health of our democracy, we believe a healthy collaboration across experts is extremely important, and where we as parliamentarians continue to play our triple role of representation, of legislation, as well as oversight. And I do know that we will have many more collaborations with the WHO. Thank you very much.
Thank you, Ms. Boyke, for the very comprehensive presentation on the actions taken by your committee, PACE, and also the importance of using evidence-based approach in the work that you did. And I'm also grateful to all the panelists for their presentation. Now we are opening up the floor for interaction, for contributions, for experience sharing and everything. We have about 30 minutes. How many minutes do we have, please? We finished at 3:40. So we have about 25 minutes to take interactions from the floor. I've been asked to share my experiences as a former member of parliament, and just to briefly tell you that I had the benefit of experiencing both sides of the aisle. I was in opposition for 8 years and then in government for 4 years. And during this time, I would say my best time in parliament was in opposition, because then I had the opportunity to criticize the government of the day, to say anything. You can shout on top of your voice, but unfortunately it doesn't get anywhere because the government is adamant. They are there to promote their vision, which may not include what you are trying to propose to them. So you can shout the loudest, you can make any criticism that you want, but unfortunately, you will not get the hearing that you deserve. On my experience on government side, that also was a bit difficult because as a member of the ruling government, MPs didn't have the opportunity to criticize government. In other words, you had to toe the party line, you had to toe the government's line. And so you were kind of intimidated, even if you had issues to raise, you couldn't express yourself. You couldn't. I know most of you here have similar experiences, but that is not the end of it. We are happy that WHO has recognized or is recognizing parliamentarians as a very strong partner. And so what we will ask of them is to empower us, to give us the training, to give us the information, and to give us the support that parliamentarians need in their various countries to push the global health agenda forward. So with these few words of experience sharing, may I open the floor for interactions? I'll start from the back there. May I know your name, please?
These are fantastic talks. Thank you for your insights and experience and giving this to us today. My name is Dr. Liam from the United Kingdom, the University of Oxford. I'm a medical oncologist. I guess the question I want to ask is, how do you deal with minority groups? So the question I face as a cancer doctor is that cancer patients don't respond to coronavirus vaccinations, and therefore there are excessive risks, and therefore you need new forms of treatment like antibody therapy. I guess the challenge is how do you recognize the needs of minority groups in a democracy who don't have a very strong voice? And also, I guess it's a UK perspective here. When our Prime Minister keeps changing and we get new health ministers every few months, how do we have leadership in this space? Thank you very much.
Thank you for your question. Ricardo, would you want to respond to that, please? Did you hear him? Okay, the floor is yours.
Well, thank you, Akua. We had an agreement where I would only answer easy questions, but that was not the case now. But it's a very important question, and I thank you for sharing that. And I think that as representatives, all of us in our communities, our constituencies, we understand that there are parts of the community that are whose voices is not heard. And so I think it has to be in the mindset of any politician, particularly working in the field of health and well-being, to make sure that not only are we the voice of those that have that don't have that voice, but actually empowering people, sometimes that are at the margins of society, to be front and center. Working from infectious diseases as my background, I ended up working with a lot of people from communities that many times were marginalized. To be honest, before working in infectious disease, even going through medical school, there were parts of society that I didn't even know about. And so it is the power of civil society, NGOs, patient advocates, and clinicians to step forward, but also of us as parliamentarians. And if you're on this stage today, it's because you are conscious of this, that we need to make sure that we put health in the forefront. And universal health coverage will only be possible if we reach all the people, which means we need to include civil society and informal parts of the system, part of that discussion, and included within that universal health coverage model. Thank you.
Yes, please. Thank you, Ricardo.
So I would like just to give one comment, because I'm also oncologist as you. And to be the member of the parliament, it's a very sustainable compared with the be minister of something. So that's why WHO and parliamentarians working together to integrate all this in one pathway. So the parliamentarians should oversight the government, and they also have authority to approve some programs or budget. So we have a big power to continue on or to use the universal health coverage for all of the nation. Thank you.
Thank you, Dr. Shiburin, for your contribution. Okay,
I just want to add something very quickly.
Okay.
I think we also need to bear in mind that civil society is not homogeneous, and sometimes there are different civil society groups that are working in a field, but they might have different views. So, for example, we were working on autism legislation recently, and there were people that had differing views of what that legislation should look like. So when thinking about giving a voice to vulnerable populations, we need to bear in mind that these populations might have very different ways of seeing the issue. So I think one way to deal with this diversity is to make formal processes for these communities to have a voice in the legislation, be it through the Congress bylaws or some form of like rules on how they will give their opinion. And in that way, at least if the rules are clear, those different voices can have a place at the table.
Thank you very much for your comments. May I kindly ask all who want to ask questions to come forward so that we can hear you well when you.
Thanks. Is it okay if I stay here? First of all, thank you for uniting to advance the most pressing issues in global health. My name is Maike. I am a German medical student, and I'm actually graduating in 1 month. And as I head off into this scary working world, there's one thing I know. It's that I want to work in a healthcare center that enables us healthcare workers to save people's lives, not only today, but for centuries to come. And at COP26, 50 countries, among them Costa Rica, Germany, and Spain, being represented here today, have committed to develop an action plan to develop a sustainable low carbon health system. So I just wanted to know if any of the parliamentarians here today could give us an update on these efforts. Thank you.
Anybody who wants to take it? Ricardo? Oh, Dr. Ullman, who wants to take it?
I just wanted to add, I'm sorry,
Thank you.
about Ricardo could take on the more difficult part of it. Maybe at the I could quickly underline a few of the efforts at the Parliamentary Assembly of the Council of Europe, where we recently passed 7 resolutions about a healthy environment, taking into account that living in a healthy environment is a necessity for our health. And what we are pushing for now in the Council of Europe is that the convention and the court system is actually expanded so that our rights to a healthy environment as individuals is legally protected by the Convention of Human Rights. So we are working on an additional protocol to the European Convention of Human Rights, as well as the European Social Charter, which would then provide the legal jurisdictional framework, if you wish, that we as politicians could make sure that you as health practitioners will be experiencing a healthy environment, but also building one together. And if that's not guaranteed by implementation of policies, then there will be a way for the law to make sure it happens. So we do have a healthy environment agenda that we're working on in the Council of Europe, which I think could be a guiding role for national efforts as well.
Thank you very much, Ms. Boeke, for your comments. Dr. Ullman, would you want to add on?
Maybe I could add on a little bit. As parliamentarians, we take this very seriously, and especially yesterday in the subcommittee on global health, that was one of our topics on the agenda that we were discussing. And of course, this has to be put into a legislation situation, has to be developed further on. But we hear it and we know it, and we are working on this from the German perspective. But it can only be a German perspective. It has to be an international globalist aspect. But nevertheless, every country should try its best to improve the situation.
Yes, that is very true. There is no one size fits all. Every country must adapt its own policies and programs to fight on. Any more hands? Okay, the gentleman, yeah.
Greetings, everyone. My name is Isidore, originally from Nigeria. I'm currently a master's student in global public health. And I actually asked this question in one of the sessions that dealt with resignation of health workers. Unfortunately, I didn't get an answer, so I'm really hoping to get one now. My question is about resignation or migration of health workers from middle or low income countries to Europe. And I, as a Nigerian, I understand the struggle for foreign trained doctors to get recognized in their home country. So my question is there a way that the global community can actually intervene? Because this is a country where we have lots of home-trained doctors migrating to Europe in search of a better life. And now you have the doctors who were opportune to study abroad and get like maximum experience and good training, coming back home to contribute their own quota to their home country, and they're not being treated fairly. They are made to go through lots of bureaucratic processes. They're made to write exams that are not transparent. You just have a list telling you if you pass or fail. You don't even know why you failed. You can't see the result. You don't know where to better prepare yourself. So the parliaments in the country, unfortunately, haven't done much to fix this issue. So my question is if the international community can intervene in issues like this, or is strictly an internal problem that we have to just deal with somehow. Thank you very much.
May I give the floor to Gaudence to respond to that? Maybe the WHO may have a strategy to deal with the problem.
I was fearing that you look at me. We do have workforce empowerment and workforce strategies, and also look at the migration. But you raise one of the not much thought of, but very delicate question. Overall, and I don't remember the exact number of millions of lacking workforce, the whole thing is that all of you need to train more. Because the resignation is also by the work overload, and migration should go in all directions, as you're rightly saying. But if there is an overall lack, whatever migration is happening, there will always be a lack, and usually in the least developed countries. So we try to help on that. On the specific one, I must admit, I'm not familiar with what, and it probably is, as you said earlier, a country by country to be resolved.
Well, in Ghana, what I know is that before people go on specialization training, they are made to sign a bond to come back and serve the country for a number of years. But these days, there are a lot of people who have absconded even after signing the bonds, and you can't do anything to them because it's a free world and there's freedom of movement anywhere one wants to go. So it's a challenge that we have to deal with anyway. Yeah. So the next question. I'll take one from the back, and then the gentleman at the back there.
Hi, everyone. Thank you for sharing your cutting edge engagements and efforts in your different constituencies. I am Echezona, and I'm a global health management lecturer at Coventry University. And my question today has to do with cervical cancer. In the last WHS meeting I attended in 2019, we had different targets developed in elimination of cervical cancer. And what baffles me is that in this year's conference, we're still talking about creating awareness and access to cervical cancer vaccine in different contexts. So my question is if we can throw a highlight on the strategies that has been implemented locally in different contexts, especially for the underserved population, and if there could be a highlight as well on how the target has been met to date. This is 4 years to the establishment of the targets. Thank you.
Thank you for the question. Is any of the panelists ready to take it? Or Ricardo, you want to take it?
I don't have any magic answer for you, but I think that when we talk about cervical cancer, I think it's one of those issues that we are united at making sure, having the tools that exist to prevent it through vaccination, to make sure that this is a reality that is accessible, not just to the few, but to all. When we talk about health for all, this is exactly what we are talking about. And what we, as parliamentarian networks here today, and Unite included, is precisely in bridging the science to the policy making, to picking up on the recommendations from trusted organizations like WHO and making them a reality. And so hopefully we will continue through our networks and working together to be able to push for these agendas, especially for those that are in most vulnerable situations, which is the case of women and children. And this is a very clear example where at a global scale, we can do more. Thank you.
Thank you. Dr. Shibrin.
Okay, let me, hello? Let me just add as an oncologist, and I know very well of the cervical cancer. So the World Health Organization is trying to eliminate the cervical cancer in 2030. That it's a very important goal. So to reach this, it's very important to educate not just the doctors and medical workers, and also the parliament members. They're all not the doctors. They need to be educated, the reason, the cause, and the pathway of the disease, and they need to be the leaders of doing the vaccination against the HPV.
Thank you very much. The gentleman over there.
Thank you very much. I'm Mohammed Al-Amidin. I'm a professor and dean of health sciences from the United Arab Emirates. Quick question. I appreciate what you have said, but I don't envy you on your positions. On one hand, you're part of political parties and serving the parties and making sure you're re-elected means you have to attend to the most acute needs of the population. And populations are often myopic. Mm-hmm. They can't see the strategic interest of the population. On the other hand, social responsibility and serving people for generations to come requires investments in public health. First, how do you deal with this paradox? And how do you balance? And second, how can parliamentarians that are doing the right things be rewarded? Thank you.
Thank you very much. Anybody wants to take the question on the panel? Okay, Ms. Marin.
So it's a very good question and a hard question to answer, but I think it's mandatory to listen to the different groups of the population and their opinions about a particular bill, but I think it is also acceptable to share your opinion, even if it doesn't coincide with the opinion of civil society. Right now, we are discussing a mental health bill that we don't have one in my country, and it's not the perfect bill, but it's moving the needle forward. And there is a sector of civil society that is thinking way ahead, like my ideal scenario of mental health, which is doing away with psychiatric hospitals. But I think the country is not yet ready to move in that leap. So we weren't able to include that, although I agree with their vision, but it's just too into the future to what our capabilities are.
Sorry, Ms. Marin, Dr. Ullman has to leave. So with your permission, let's applaud him before he leaves. Thank you. Yeah, please go on.
It's okay. I'm not sure if I handle it the correct way, but I try to explain why I didn't agree with them and why we kept the bill as it is. But I think what's mandatory is always listening and giving your honest opinion if you don't coincide with their vision.
Thank you. Are you okay with the answer? Quite okay. Maybe you can see her later for details. How many more do we? Sorry. Please go ahead.
Thank you, Akua. I want to say that in a lot of countries, there is a strong civil society. And these ONGs and the other foundation and task force who operate in the society used to be very strong and very demanding. And as politicians, we have an exam each 4 or 5 years. So if you don't pass the exam, you don't be to maintain in politics. So it's very important to be very close of this civil society and to hear everything and to dialogue in the parliament. The difference between the government and the parliamentaries, as for example in IPU, is that in that kind of organization, we have to dialogue everything because we are not all our government who has only one position. You have a huge number of different positions, and you have to have a consensus in order to promote a line of action. So it's why Parliament is so difficult to have decisions in the correct way. So, but it's part of this work, and it's why it's so plural, so representative, so close of the people. But the people is very demanding in your constituency, and if you don't do what they are expecting from you, you don't repeat as a member of parliament.
Thank you, Mr. Shanis, for your contribution. Yes, please. Can we have you? I thought you Okay, please.
All right, thank you very much. My name is Dr. Ohineba Osudansu. I'm the Chief Executive Officer for the Komfalachi Teaching Hospital in Ghana. My question is, we've been discussing a lot of issues as far as investment in health is concerned. And I think for the wonderful panelists we have listened to this afternoon, a lot have been said in that area. What are the strategies we have done wrong in the past? And what can we revise as far as strategies are concerned in actually having impact on the minds and hearts of the decision makers, of the governments? Because I think as parliamentarians, we have a big role to play as far as changing the paradigm, as far as how much of the GDP or how much of our budgets goes into health and public health is concerned. I think we want to hear something from you as to what we can do, probably led by the WHO itself, to impact on how much governments commit to health, especially looking at the economic benefits of investment in health. The second point is about the health workforce migration. I wasn't too satisfied with the answer that came up. The issue is, we have done so much in Ghana in the last 10, 15 years as a former General Secretary of Ghana Medical Association, where postgraduate training programs have been established for pharmacists, doctors, nurses in country, where a lot have been done in terms of motivating health workforce, and it's turned the tide a bit. With the advent of COVID-19, and the last 2 years, we've seen a huge scale up of migration of health workforce. My question is, can the WHO, parliamentarians meeting here, look at the global map of health workforce trained and where they are moving to? If there's insufficiency, what could we do to make sure that the developed world invests much more to train more health workforce so that these push and pull factors are actually stemmed? Thank you very much.
Thank you, Doctor. Anybody wants to respond to the question? Any of the panelists?
A quick intervention on the first part of the question and maybe briefly on the second one. I think both are extremely relevant for us politicians. One, what was the mistake of the past that actually brought us here into a huge, seeking a new global health agenda? I think was commodification of our basic human rights. Our health is a human right. Therefore, it is something that has to be protected and ensured and guaranteed by the state, whose responsibility and duty is to make sure that our rights are well protected. So as a politician, I think this is one message that we have to be very clear on. And second is, therefore, it's investments in human rights are not costs. And I think this was a message that was given by Dr. Tedros this week as well. And we underline it in every effort and platform we have. These are investments and not costs. Therefore, education, health, housing, and now energy, we are learning, is our basic human rights. Therefore, they are investments we have to make sure are a core part of our public agenda. As for the health workforce, I think I would add to that the unpaid care work that women do as well, and bring us to the question of what is the value of work and how do we value work itself? And as long as we don't value work in terms of this rights-based framework, unfortunately, I would fear that healthcare workers, women who are taking on much of the unpaid care work in the world, will not be rewarded for the immense service they are providing. And again, this should be a change in attitude that we have to pick up. So as politicians, we will definitely carry on the message that we've heard here into our parliaments and our international bodies that we work in.
Thank you very much. I just want to add that on this specific issue of migration of health workers, countries must deal with it individually. I think we must come up with policies and laws that will check the excessive level of migration, because as I indicated earlier, there can be no one-size-fits-all solution to all these problems. So each country must assess their situation and take measures to address them appropriately. At this point, may I kindly invite Gordons to come on stage and say the final closing words to us. Thank you very much.
Thank you very much, Aqua. Thank you to all the parliamentarians and to the audience. Very rich debate, a lot to do. We stand ready to work hand in hand with all those parliamentarian groups, the IPU, Unite, EPF, the regional networks, the regional organizations such as PACE, but also Pan-African and other parliaments. So we stand ready to work closely with parliaments. I think yesterday and today we have taken our parliamentary work to a new level, and we will go even stronger. Thanks a lot, and looking forward to meet soon again.